Hi, I'm Dr. Sami Khan. I'm an orthopedic surgeon with Resurgence Orthopedics here in Johns Creek. I specialize in sports medicine and reconstruction of the shoulder. There are different types of shoulder replacements, and they are done specifically for what type of condition you have. There is a type of shoulder replacement done when you have bad arthritis between the ball and socket. That is an anatomic total shoulder, meaning you replace the ball and socket with a ball. The second type of shoulder replacement is for someone who has bad arthritis as well as bad rotator cuff injuries, severe rotator cuff tears. In this situation, we do reverse shoulder replacement where we flip the ball and socket around to let the deltoid muscle be the workhorse for the arm. Shoulder replacement has really advanced in the last few years, making it easier for patients to recover. I think the biggest thing again is our technology is improved, where surgery is faster and more straightforward. Patients can go home and not stay in the hospital overnight. Secondly, we are now getting CT scans and a three-dimensional picture of someone's shoulder socket prior to surgery. When we do that, when we do the surgery, we basically preserve as much bone, and we have guides that are created specific for the patient's shoulder. This preserves the patient's bone, it makes the surgery more accurate, and I think it's going to add to the longevity of the shoulder implant.